I think MD Anderson nurses are so dedicated to our mission of ending cancer. They are truly the glue between the science and the care we have for our patients every day.
My dad came to MD Anderson, and he was being seen for recurrent cancer, and he was extremely anxious and nervous. It wasn't really so much what the nurses said, but how they made him feel. They really made him feel comfortable, like he was the most important person there.
I've had a number of colleagues from other institutions want to come to MD Anderson for either an opinion or for treatment. And universally, they always let me know what a great experience they had. And the number one thing they mention is the nurses.
Meeting nurses at MD Anderson during my interview here was really the clincher that made me decide that this was the right place for me to come to become a leader in cancer care. The nursing engagement, the high quality of care that's provided, the multiple magnet designations that we've seen across our nursing care really showed that this was an environment where nursing leaders were guiding the kind of high quality care we want to provide.
I often will round in the inpatient hospital with Carol Porter and often with Steve Swisher and Chris Flowers, and I'm always struck by the teamwork and the camaraderie and the pride in the work that the nurses have.
Clinical research nurses are so important to the clinical research we do every day, not just the scientific part and making sure the protocol makes sense, but they're the ones often talking to the patient every day, making sure the patient is educated on the side effects, being that touch point so the patient knows that their team cares and is on top of their symptoms and their concerns on a daily basis.
The Foundation for the Accreditation of Cellular Therapy, FACT, was established in 1990, and it's a national and now international organization that accredits all of the stem cell transplant programs. Our nurses have been phenomenal. They just blew the inspectors away. This inspector told our team this was the best inspection he's ever seen, the best program in the United States, and we got no deficiencies, which is almost unheard of for FACT.
I'm just amazed by the care and compassion, and almost all the nurses that I talk to, they have a story about how cancer's impacted them, and it adds even more compassion to the way they go about their mission, and that's what I think really makes MD Anderson nurses special.